Experts are calling on the federal government to establish a national strategy for HPV screening and cervical cancer prevention. A bill is having its second reading in the Senate today, and that would establish a legislation national framework for women's health. Dr. Vivian Brown, the chair of HPV Prevention Week in Canada, joins us this morning. Good morning to you.
Good morning, Melissa. Thank you for having me.
We're very excited to have you here and discuss this even further. So tell us a little bit why today is such an important moment to be talking about women's health and cervical cancer prevention.
Well, what this bill does, and as you said, it's coming to second reading, is it really establishes a national framework for women's health and recognizes women's health as a national priority and recognizes women's health as a core value in the Canadian healthcare system. And hopefully this will prioritize prevention, early detection, equity, and accountability. And cervical cancer is just one example of where this is so important and why we need a coordinated national action plan.
Can you tell us a little bit more about Bill S-243 directly and how it does support cervical cancer prevention?
Well, the bill essentially is creating a framework to prioritize women's health. And really what that means is across the country, no matter where you live, no matter what your postal code is, you should have equitable access for prevention, prioritizing studies, prioritizing research. And historically, women have not had a lot of research in women's health. What we know with cervical cancer, as an example, is Canada is behind other countries. The World Health Organization has set up a goal, and we are not at that goal. Our actual numbers of cervical cancer are on the rise, not on the decline. And what's really important about cervical cancer is we now know that HPV screening, which can be done in your doctor's office or can be done with self-screening in certain provinces, is the way to go. It's an early pickup for abnormal HPV, which is a marker or a risk factor for cervical cancer.
And can you tell us more about this HPV screening? Does it differ than the Pap test that most of us are familiar with?
Yeah, well, that's a really good question. The Pap test picks up abnormal cells, whereas the HPV screen is picking up HPV or human papillomavirus before it has a chance to affect the cells. So it's an earlier pickup, it's more accurate. And if you are negative, it gives you a longer time between screening. You can wait 5 years until you're screened again. Other countries have been doing HPV screening for quite some time. In Canada, different provinces have done things differently, but we're now doing HPV screening rather than a Pap test. And in some provinces, we're even doing self-screening. So for northern communities, people without access to medical care, they may be able to self-screen themselves, send it in, and have a follow-up so that they're not out of the screening protocol, so that they're still getting screened, they're still getting assessed for risk of cancer.
And what's your message to senators today as they consider to vote on Bill S-243?
Well, my first message would be thank you. Thank you for paying attention to this issue. Thank you for stepping up. And absolutely, we want our senators to vote on supporting this bill, because this bill is important for all Canadians, but particularly for women. And it's for women across the country. And as an individual Canadian, you can write to your senator, you can write to your MP, you can write to whoever is in power in your area of the country to support this bill. You know, women's health needs to be a core value in what we're doing, a core value in healthcare, so that research and priorities and prevention all come together and that we protect women as time goes on.
Perfect. Thank you so much for joining us today.
Thank you.